Hello everyone. So in this video we will be studying the stains, the important stains used in the pathology. So first of all we will be discussing what are the stains used for carbohydrates. The PAS stain is used for glycogen, neutral mucin and mucoprotein. Okay, the green ones which are marked are that which are used for different substances or different things. So that we will be studying in the end that what are the stains that are used for multiple things. So PAS is for glycogen, neutral mucin and mucoprotein. Alcian blue at pH 2.5. At pH 2.5 it is used to differentiate between acidic and neutral mucin, and that is for the Barrett's esophagus. Then Alcian blue at pH 1. At pH 1 means it will be very acidic. So highly acidic mucins or sulfated mucins is what that is used for. Then is mucicarmine. Mucicarmine is acidic epithelial mucin. Mucicarmine is a specific stain and it is used for acidic epithelial mucin. Then we have minerals. Minerals we use pigments and miscellaneous. Von Cosa stain for calcium and alizarin red is also for calcium. So how we will remember in the von Cosa K is coming. Let's remember that Cosa or Cosa can be also from C. So K and C are means similar voices. So von Cosa is for calcium, and in the alizarin red we have Al, and in the calcium also Al is coming. So alizarin red is for calcium. So how will remember? C, from the C we have Cosa and from Al we have alizarin red. Then Prussian blue stain. Prussian blue, also known as Pearl's iron stain. It is for iron. Then Orsin modified rhodamine. Orsin modified rhodamine is for copper. In Orsin O is coming and R is coming, and in rhodamine also R is coming. So both the O and R are also coming in copper. So Orsin modified rhodamine is for copper. Fontana Mason strain. Fontana Mason. In the Mason M is coming, and in the melanin also M is coming. So Fontana Mason strain is for melanin. And modified Fawcett is for bile pigments. Modified Fawcett bile pigments. Then we have connective tissue and lipids. In the connective tissue and lipids, we have a mnemonic CTEV. Okay, CTEV is used in the medical sciences, the term. So CTEV is a mnemonic. For the collagen, we have trichome strain, and for the elastin, we have Verhoef van Giesen strain. Collagen trichome, elastin Verhoef van Giesen. Then for the reticulin RS. Next letter to R is S. So reticulin silver methenamine stain. Then the next ones we don't have any mnemonic. We have to read again and again to remember it. Moschus scarlet blue. Moschus scarlet blue is for fibrin. Then Wilczewski stains, that are a type of silver stains for neurofibrillary tangles and senile plaques. Luxol fast blue. Luxol fast blue is for myelin. And PAS stain and silver methenamine stain. This is for basement membrane. Then oil red O stain and Sudan black. Oil red O is used in case of fresh specimens, like on the frozen section, and Sudan black is used in the fixed specimens. So what stains we have studied in connective tissue and lipids? Trichome stain, Verhoef van Giesen stain, silver methenamine, Moschus scarlet blue, Wilczewski, Luxol fast blue, PAS silver methenamine, oil red O and Sudan black. Then we have microorganisms. In the microorganisms we use May-Grunwald-Giemsa stain. May-Grunwald-Giemsa stain is used for bacteria and blood elements. Then Zn and quinone stain is used for acid-fast bacilli. Ziel-Nielsen stain. Grocott methenamine silver and Gomori methenamine silver. That is silver stains. Methenamine silver stains and PAS stain. This is used for fungus. Then Toluidine and Steiner's. Toluidine and Steiner's method is used in H. pylori. Remember by the mnemonic TSH, thyroid stimulating hormone. Toluidine, Steiner, H. pylori. Shikato's orsin stain. Orsin rhodamine also was there in the copper. Then Shikata's orsin is in hepatitis B antigen. Marshy Vellows R and V is coming. So it is for rickettsia and viral inclusions. Then is mucicarmine. In mucicarmine, two C's are coming in cryptococcus. Also many C's are coming. So mucicarmine stain is for the cryptococcus. Mucicarmine also was for the specific stain for the mucin, and it is also used in the epithelial mucin and also used in cryptococcus. Then is Warthin staris. Warthin staris stain is for spirochetes. Like in spirochetes, we use dark ground microscopy. So Warthin stari means, remember, like starry sky is dark. So Warthin stari stain is for spirochetes. Calcofluor white is for acanthamoeba and it will stain white. Then we have hematological cells. Hematological cells we have Ramnowski stains. In the Ramnowski stains we have Jamesa, Leishman, Wright and Jenner stain. The four stains are included in the Ramnowski stain and it is used for routine blood and bone marrow. Then myeloperoxidase and Sudan black B. Myeloperoxidase for myeloid cells and also the one Sudan black B is for myeloid cells. Myeloid cells also have OR rods and the nucleoli. What is the difference between the myeloid cells, that is myeloblast, and the lymphoblast is very important. So we need to remember that OR rods and the multiple nucleoli and the lesser amount of NC ratio, that is the feature of myeloblast. Then in non-specific esterase, in the non-specific esterase N is coming and in the monocyte also N is coming. There is no N in myeloblast or myelocytes. So monocytes we use non-specific esterase. Then acid phosphatase for T lymphocytes. Then acid phosphatase, like we use lab score and other scores in the conditions, that one is mentioned here, acid phosphatase T lymphocytes. Then pass in the lymphoblast and erythroid cells. In the lymphoblast it will be block positive and in the erythroid cells it will be granular positive. In the blast it is block positive, lymphoblast and block positive, and erythroids are granular positive. Then trap stain, trap tartrate resistant acid phosphatase, it is used in hairy cell leukemia. Then we have tauladine blue stain. Tauladine blue stain is used for mast cells and basophils. And tauladine blue stain is also used for finding the pre-malignant lesions in the oral cavity. Then we have stains for amyloid. In the amyloid we have Congo red stain and it is giving apple green birefringes. Then we have special stains for liver. We will be discussing it in the meanwhile, but let's revise the stains we have done earlier. So starting again and repeating it quickly. So first we had the stains linked with the carbohydrates. In the carbohydrates, we have PAS stain for glycogen, neutral mucin, and mucoprotein. Then Alchin blue at 2.5 pH for differentiating acidic and neutral mucin. Alchin blue at pH 1 for highly acidic mucin, that is sulfated mucin. Mucicarmine specific stain for acidic and epithelial mucin. So PAS 1 is here, glycogen, neutral mucin, and mucoprotein. And mucicarmine was also in the cryptococcus. Then in the minerals we have von Cosa and alizarin red for calcium, Prussian blue or Pearl's iron for iron, Orsin modified rhodamine for copper, Fontanella mason for melanin, modified Fawcett for bile pigments. Then connective tissue. In the connective tissue, remember CTEVRS, CT collagen trichome, elastin Verhoef van Giesen, reticulin silver methanamine. Moisture scarlet blue for fibrin, Bilchowski for neurofibrillary, and Snilplax, Luxol fast blue for myelin, PAS and silver methanamine Also for glycogen we have done pass and silver methenamine also for basement membrane. Then for fat we have oil red O and Sudan black. Oil red O for fresh specimen and Sudan black for fixed specimen. Then in microbes we have May Grunwald Giemsa stain for bacteria and blood elements. Zn or quinone stain for acid fast bacilli. Grocot methanamine silver and Gomori methanamine silver and PAS. PAS was for base membrane for glycogen and here it is also again for fungus. Then toluidine steiner for H. pylori, Shikata sourcin for hepatitis B antigen, Marshivellus for rickettsia and viral inclusion, Mucicarmine for cryptococcus, Warthin staris, Pyrokids, dark ground microscopy, Calcofluor white, we have a Acanthamoeba. Then hematological cells, we have Romnowski stains for routine blood, Myeloperoxidine Sudan black B for myeloid cells, non-specific esterase for monocytes, acid phosphatase for T lymphocytes, PAS positive. PAS was for fungus, glycogen, and for the basement membrane. And here again PAS comes for the lymphoblast, block positive, and erythroids, granular positive. Trap positive, hairy cell leukemia. Toluidine blue, mast cell, and basophil. Amyloid, Congo red, apple green, birefringence. Then we have special stains for liver. In the liver, what special stains are used? We have Mason trichome stain that is used for collagen type 1. CT we have done. And it is used in chronic liver disease, perisinusoidal fibrosis, will be there in steatohepatitis and periductal. Periductal fibrosis will be occurring in primary sclerosing cholangitis. Then Gordon and Sweet's reticulin stain. Gordon and Sweet's reticulin stain, it is used for reticulin and it is used at type 3 collagen and it will stain black. The first one, mesenteric was staining blue, but it is staining black and it will stain liver, spleen, lymph nodes. It is used in liver fibrosis, myelofibrosis, hemangiopericystoma, and endothelial cell tumor. And it will differentiate the hepatic plate architecture. Like hepatic plate architecture will be expanded in the regenerative and neoplastic condition. It will be compressed in nodular regeneration and it will be collapsed in necrosis. Then we have Prussian blue or Pearl's iron stain for iron. In the hemosiderin it will be coarse blue and for the ferritin it will give faint blue. F for ferritin, F for faint blue. Cytoplasmic blush. PAS is for bone marrow, fungus, and if the diastase resistance is present then it is used in alpha 1 antitrypsin deficiency. Oil red O for fat and it is used for evaluation of pre-transplant liver biopsies. Then rhodamine is for copper and it is used in Wilson's disease. So that's all about the important stain they uses in the pathology. I hope you will find this content useful. Thank you.